Good evening, everyone. Before I get into the formal part of my speech, perhaps by now some of you have heard the shocking news that the Australian journalist Peter Gresti has been sentenced to 7 years in an Egyptian jail simply for reporting the news. Our thoughts tonight are with Peter and his family. Labor will work with the government in every effort to secure his release. And sadly, Peter Gresti is one of over 200 journalists in jail around the world. And it is a grim reminder that freedom of speech, which so many of us take for granted here, is something to in fact celebrate and to jealously guard. Difficult news indeed. But good evening. I'd like to acknowledge the traditional owners of the land upon which we meet, pay my respects to their elders, both past and present. Tonight, as we meet to discuss the state of our nation, and I acknowledge that for many of you who are here, you are time poor and that you would put aside so much of your time to talk about these matters, I think is an important addition to our national debate. I would like to focus on a question that CEDA has a proud tradition of considering in thoughtful detail: the state of our federation. A cooperative, productive relationship between the Commonwealth and our states is central to our economy, our society and our nation. And indeed, I know with John Brumby here, he's engaged in that debate from at least one point of view. But it isn't my aim tonight to give an up-to-the-date view about every latest twist and turn or to offer commentary on last week's High Court decisions. In government, though, Labor did pass legislation to protect Commonwealth programs challenged by the first Williams decision, and we will work with the government if similar action is required in the light of last week's decision. But my focus tonight is not upon the legality of Commonwealth action, but the important balance between the Commonwealth and the state responsibilities in our federation. I would submit to this audience that this balance has been severely damaged by this government's most recent budget. There has been a lot of debate about this budget, and some of the most controversial, indeed most widely discussed elements of the government's budget are measures which run contrary to our national sense of fairness and our inclination to address inequality with compassion. People have become familiar with these matters: the GP tax, dismantling accessible universal health care, tough cuts to family support, pensioners, carers and veterans, radical changes to increase the cost of higher education beyond the reach of children from low and middle income families, the very difficult abandonment of Australians looking for work, forcing job seekers under the age of 30 to survive on nothing for 6 months. Now, together these measures represent the most radical social experiment in Australian history, and Labor stands ready and strong in our opposition to them. Inevitably, our opponents have sought to paint us as reckless. But let me say this to this esteemed group tonight. I and Labor understand the importance of making the budget sustainable, the need to bring together revenue and expenditure over the budget cycle and over the medium term. It's why Labor made $180 billion of responsible savings in government. It's why we remain very critical of the government's $22 billion paid parental leave scheme and their $2.5 billion direct action policy. It's why we legislated reforms to the private health insurance rebate, a policy that will save nearly $25 billion over the next decade, but was sadly fought tooth and nail by the Liberal opposition. It's why we moved to raise an extra $5.3 billion in revenue by closing loopholes on profit shifting and multinational tax evasion, a position that has since been watered down by this government upon coming to power. Labor recognises that to be sustainable, a budget must also be fair and reasonable. Yet this budget is designed to hurt the vulnerable and makes those who can least afford it carry the highest burden of the budget. It assigns the heaviest lifting to the weak and only the lightest touch to the strong. This budget, I would submit to you, will do nothing to boost participation, productivity or improve social mobility, the key drivers of economic growth. Indeed, the government's cuts will reduce payments in the near term, but only at the expense of growth in the longer term. And this year's budget also contained a surprise attack on the state governments of Australia, a dramatic and reckless destabilising of our federation, a cut in spending on health and education that grows to around $20 billion by 2024-2025 financial year. In total, over the next 10 years, there's an $80 billion cut to Australian schools and Australian hospitals. So far, the only explanation that the Prime Minister has offered is that health and education are traditionally state responsibilities, and he wants the states to be sovereign in their own sphere. It is the same argument that he has used to justify his refusal to fund long-term public transport infrastructure. On budget night, the Treasurer was more pointed. When asked whether his budget was designed to starve the states into begging for an increase in GST to fund the shortfall in school and hospital funding, the Treasurer replied, "Well, that's up to them. They are responsible for schools and hospitals. We don't run any schools and hospitals." Whether you take the Prime Minister's wording or the Treasurer's blunt formula, this is an alarmingly narrow view of the role and responsibility of the Commonwealth Government. Indeed, this is a characterisation of our political structure that goes way beyond what is sometimes described as black-letter law of our Constitution. This is a hyperliteral, reactionary interpretation of the Australian Constitution. This budget represents a view that will turn the clock back on more than a century of change and evolution in favour of a model that is fundamentally at odds with the reality of governing modern Australia. It is true that when our Constitution was drafted, the colonies retained responsibility for a range of frontline services. It is true that in 1901 there was no Commonwealth Department of Health or Education, but there was also no Department of Finance or Transport, Industry, Communications, Indigenous Affairs, Arts, Sport or Environment. There wasn't even in 1901 a Department of Prime Minister and Cabinet, and actually for that matter, neither Prime Minister nor Cabinet are mentioned in our Constitution at all. 11 decades of transformation and growth in our Australian economy and Australian society have expanded the breadth and depth of the role of the Commonwealth Government. It is wrong of any government, of any political stripe, to wash its hands of fundamental roles which this Commonwealth has evolved over the last 113 years. The Australia of 1901 had no social safety net, no minimum wage, no accessible higher education, no universal health care, no superannuation. It was a country where women were disempowered, where migrants were distrusted, and Aboriginal Australians were counted as fauna and deemed destined for extinction. This was the Australia then that shaped our Constitution, a protectionist, monocultural collection of colonies so very different to our confident, modern, outward-looking and diverse nation of today. Tonight, I simply argue to you at CEDA that just as our nation has demonstrably changed for the better since Federation, the way we govern ourselves has evolved and improved too. While our Constitution remains a fundamental part of our national organising principles, it is far from an up-to-the-minute handbook of the business of government, or an accurate description indeed of the interplay of funding and responsibility between the Commonwealth and the states. I believe that Australia is governed best when we adopt the pragmatic and practical path, not the theoretical journey to the future. As the dominant collector of revenue, it is inevitable that the Commonwealth will play a role in funding the delivery of essential state services, especially in health and education. This is not a new concept or a radical one. But this budget, leaving aside the headline issues which have dominated so much of the debate since the budget, this question of the fundamental reorganisation of state and Commonwealth roles will be at least as great an impediment to the future growth and evolution of our nation as any of the particular measures that I've spoken about earlier. And we have been on this path of recognising the increased role of national government for many decades. Last month recognised the 50th anniversary of the State Grants Science and Laboratories Technical Training Bill. This was a piece of legislation 50 years ago that provided capital grants for science laboratories and equipment in Australian secondary schools. When the then Prime Minister, Robert Menzies, introduced this legislation to the Parliament, he articulated the principle which has underpinned the last 50 years of Commonwealth support for education. Prime Minister Menzies said then, "My hope is that the Commonwealth monies can, with great benefit, be used to stimulate activities which could not be afforded previously by either state or independent schools." Every Prime Minister since Menzies, from both sides of politics, has subscribed to this idea, the recognition of the role of the Commonwealth in education in Australia. I and Labor are proud that the quality and focus of Commonwealth investment in education reached its most recent high point in the historic needs-based reforms, also known as the Gonski reforms, for school funding. If we look at health, we see the same trend, recognising the central role the Commonwealth plays in the health systems of Australia. The federal government has stepped up to fund the services our citizens depend upon. The Commonwealth filling the gap created by the diminishing revenue bases of the states. Or indeed, as a certain T. Abbott put in his book Battle Lines not so long ago, and I quote again, "Commonwealth spending in health and education is all in the areas that were once wholly the preserve of the states. Most of it is not directly authorised by the Constitution, other than via the specific grants power under Section 96. He then went on to write, "Still, any withdrawal of Commonwealth spending in these areas would rightly be viewed as a cop-out." This is the same person. It is rare for me to quote, I do recognise, Tony Abbott and Robert Menzies with approval in the same year, let alone the same speech. But I think, as a citizen of this country and leader of the opposition, it is worth reflecting on the difference between the Tony Abbott who wrote Battle Lines and the Tony Abbott who wrote the budget. On the one hand, you have the straight-talking conviction politician who believe that the federal government should not cop out of supporting schools and hospitals. On the other hand, we've got the Prime Minister, captive to both his broken promises, but unable to explain or justify the decisions in the budget consistent with what he said in the past. So I do believe that Tony Abbott is correct, or at least he was correct when he wrote Battle Lines in this part. For the Commonwealth to withdraw any spending from schools and hospitals is a cop-out. It is a fundamental reshaping of federation. It is even more serious than that. It's an abdication of leadership. It is not enough to aspire to lead this country, yet strand the states and territories of Australia with a second-rate funding system. It is not right to pillory the states and say that is their problem. The states and territories of Australia certainly try and do their best in the journeyman issues of Australian politics, the schools, the healthcare, the other matters which states take responsibility for delivering, but they do so on the basis of a Commonwealth government willing to show national leadership. This is Labor's fundamental objection. Demanding the states to do more with less will lead to a catastrophic impact upon the schools and hospitals of Australia. Behind the government's wordplay, there are deeply harmful consequences arising out of this budget, entrenching problems for our society and our people in the next 10 years. By the financial year starting July 1, 2024, The government will be taking $15 billion out of health, a total cut of $50 billion to hospitals. In our climate of accelerated media coverage and shorter attention spans, it is possible for a number like $50 billion to simply wash through the national debate without it getting the attention it deserves. But I think that everyone can agree, when we pause to think, that taking $50,000 million from hospitals is a big number. The real test is, though, what these cuts mean and the toll they take on our healthcare system. Over the past month, Labor has analysed the impact that these unprecedented cuts will have on the public hospitals of Australia. The consequences are truly staggering. Taking $50,000 million out of our hospital system is the equivalent of removing more than 4,300 hospital beds and more than 25,000 nurses and more than 12,200 doctors for 7 years. It's the equivalent of sacking 1 in 5 nurses, 1 in 3 doctors, and closing 1 in 13 hospital beds in public hospitals for 7 years. In terms of procedures, what this money would buy, it is the equivalent of more than 104,000 hip replacements, more than 1.4 million chemotherapy sessions, more than 241,500 mental health admissions per year for 7 years. There are most serious questions to be answered. How much will patients have to wait in overcrowded and chaotic emergency rooms? What will happen to the waiting times for elective surgery as a result of the Commonwealth's abandonment of leadership? How long will people have to wait for treatment when they have time-critical conditions? What kind of medical equipment will hospitals have to shut down before they cannot afford to maintain them? How many rural and regional hospitals will close? How many Australians will be turned away or denied treatment because our system cannot cope? How many employers will have to pay more in wages as people seek a flight to better funded systems for themselves? What lives will be put at risk because people cannot get the help they need? The consequences in education are just as severe. By 2024, July 1, Australian schools will be suffering from a funding cut of $5,000 million. In total, budget cuts around $30,000 million from Australian schools. This is the equivalent of taking about $3.2 million from every school. Think about the schools you drive by on the way to work and understand that they will lose $3.2 million over the next 10 years. That is more than $420,000 per school per year from 2018. That's more than $1,000 being spent on your son or your daughter or your grandchild per year. It's the equivalent of sacking 1 in 7 teachers. It's about 40,000 teachers. Put it another way, this funding could put an extra 4 specialist teachers in every Australian school and pay their salaries for 7 years. We could, from scratch over that time, build 1,800 new schools. So again, whilst the government says that we use these numbers to scare people, I would submit to you that the truth of this budget and the repercussions will be felt not just in opinion polls, but through the next decade beyond, which will indeed affect Australian prosperity. How fast will Year 12 completion drop, the rate of completion? How many students with learning difficulties or impairments will fall through the cracks? How many parents will have to make the difficult choice between seeking integration support in a mainstream school which no longer exists or sending their child to an overcrowded special school? How much wider will the gap in Indigenous education outcomes be as a result of reduced support in remote schools? How many young teachers will be unable to cope without the right resources and look for work elsewhere? How many experienced teachers will finally decide that enough is enough? The schools simply aren't getting the support they need. What will be the difference between a great school and a school deprived of the funding it needs? Now, these $80 billion cuts may be part of this government's social experiment, but the test subjects are literally the quality of life of millions of real Australians: patients, doctors, nurses, students, teachers, parents. The only response this government offers when the opposition has raised the question of the $80 billion in cuts is we don't run any schools or hospitals. I believe that Australian students, Australian patients, Australian taxpayers deserve better than shoulder shrugging and finger pointing. We deserve better than the immature policy response that can be summarised with "it's not our problem." You are here grappling with the future of this country. But as you do this, to what end can that achieve as we see the federal-state relationships of Australia being literally upended? Our nation deserves better than a national budget which shirks its responsibilities. The harm caused by these cuts goes well beyond classrooms and medical treatment rooms. Massive cuts to state budgets will have significant implications in every area of state government expenditure and revenue. Talking about state-federal relations isn't as exciting as talking about other matters. But imagine, if you will, that you're the Premier of your state. We can ask John to channel it for us. Making plans for growth in your economy. You weigh up your total outlays. You think about how you can best allocate funding from your narrow funding base. You make assumptions on the basis of the global economy, the impact it will have on your state. You look at your demography, you make assumptions on the basis of your population profile. You think about your industry base, how it integrates with the rise of Asia, with the pressure of the high Australian dollar, and competing in an increasingly globalised marketplace. These are the rational and sensible assumptions that inform your decisions. But you do assume, reasonably, that the payments from the Commonwealth will continue on the basis of signed, negotiated agreements and decades of precedent. On that basis, you make plans to expand skills and training and encourage innovation. You introduce reforms to improve the efficiency of your health system and your hospitals. You focus on student outcomes, providing the best learning environment. You pull all these threads together, economic and fiscal, in a plan for your state and for the Australians who live in your state. That's your budget. Then comes this bolt out of this blue, this surprise 2014 budget. No matter how many times the government would seek to deny the scale of the cuts, their impact will be felt. You cannot afford to ignore them. Beds will close, treatments will be delayed, staff will lose their jobs. Learning outcomes will suffer, schools will close, teachers and classroom assistants will lose their work. This is the first time when you realise that for the first time in Australian history in a very long time, the Commonwealth itself poses a sovereign risk to the states of Australia. The government isn't rewriting agreements, it's repudiating agreements. They're shifting the goalposts on you, making the efficient and effective delivery of services nigh on impossible. Impossible, that is, without increasing state taxes or blackmailing the states to carry the can for an increase in the GST. Ladies and gentlemen, tonight when I said I wanted to talk about the fundamental shift in the balance of Commonwealth-state relations, this is what I mean. I understand, Labor understands, the need for an ongoing, meaningful national dialogue about the future of our federation in this forum and in others. It is clear to me that there are tremendous economic benefits to be gained from a cohesive, cooperative federation. I am ambitious for a better way of Australia working together, regardless of allegiance. But I do not accept that it is anything other than lazy politics to argue that this nation has to be a nation of lifters, not leaners, to argue that we must all wear change and then shove most of the change onto state governments. That is not leadership. When I see this government making huge unilateral cuts to health and education with no consultation, I doubt the capacity and the willingness of this current government to deal with the business of Commonwealth state reform in any meaningful way. I truly do not believe that some in this government really understand the consequences of the budget they brought down. I certainly hope they don't understand it, because the alternative means they simply don't care. We believe that every school can be a great school. We believe every Australian deserves access to universal health care. Universal affordable health care. We recognise that we need a federation that works together is the only path forward. But we also recognise in this budget that the challenge of a budget is to unite the nation, not divide the nation. Not only is it a tax on the sick, not only does it discourage parents from hoping their kids can go to university, but indeed when it comes to state-federal relations, somehow all the states have been painted in the corner as the baddies and the federal government as the goodies. I know that life is far more complex than that. Thank you very much.